We are now going to hear from some of the Victorian contingent who are going to update us on the situation down there. We have Mr. Matthew McCrone and Dr. Dayna Swiatek from the Victorian Medicinal Cannabis Task Force, and they're going to give us an update on where medicinal cannabis is up to in our neighbouring state. Mr. Matthew McCrone is the Director of the Medicinal Cannabis and Real-Time Prescription Monitoring Task Force in Victoria. He is a trained pharmacist and has worked in both the Australian and Victorian public service. Dr. Dayna Swiatek is the Senior Policy Officer within the Medicinal Cannabis Task Force and has a background in medical research. The task force was established in 2015 to implement the Victorian Government's election commitment to legalise medicinal cannabis in exceptional circumstances. Ladies and gentlemen, Mr. Matthew McCrone and Dr. Dayna Swiatek.
Morning, everyone. I'm Matthew. I head up the area within the Victorian Department of Health and Human Services where our Medicinal Cannabis Task Force sits, and this is Dayna. So may I begin also by acknowledging the traditional owners on whose land we meet and pay my respects to elders past and present. Thank you to the organisers of the United in Compassion Symposium for inviting us here today to share with you an overview of the Victorian Medicinal Cannabis Scheme. We will be covering the following topics in our short presentation. We'll be describing to you the legislative framework that is now in place in Victoria, which allows access to medicinal cannabis in exceptional circumstances. We will talk a little bit about the chronology of how this social and legal issue came to the forefront of discussion in Victoria. We will talk about the genesis of the scheme, how it came to pass, and how we came about developing the policy and the regulatory framework around it. We will outline the key aspects of the scheme, and we will give you a quick overview of how we are phasing in the framework in Victoria. So, this subject's already been covered, but I'll just quickly say there is no question that cannabis is a very tightly regulated substance. The legal and social obstacles are entrenched and they are complex. They include international treaty obligations, Commonwealth therapeutic goods laws, and strongly held views in both medical and wider communities. For decades, cannabis has been categorised in international and national law as dangerous and addictive drug with no therapeutic application. Despite several parliamentary inquiries and even draft legislation, in recent years, no state or territory has really made headway.
The original Sunday night program that featured the remarkable courage of Dan Haslam and his family triggered national discussion, sympathy and support for medicinal cannabis. I would like to thank Lucy for her dedication to continuing Dan's fight. It is stories like Dan's and others that have had a significant impact on progress of this issue in Australia. In Victoria, it was the story of Cooper Wallace that provided the momentum for change. And I would like to acknowledge Cooper's parents, the courageous Rhett and Cassie, who are attending this symposium today. Cooper, who is now 4 years old, was born healthy but contracted bacterial meningitis as an infant. The condition left him with severe brain damage, epilepsy and cerebral palsy. His seizures would last up to an hour and a half, and doctors said there was nothing they could do. Cooper's parents turned to the black market out of desperation. Following the Sunday night program, Cooper's story was picked up by radio and television in Melbourne and won the hearts and minds of Victoria, including the opposition at that point. Medicinal cannabis became an intensely contested issue at the state election in late 2014.
So, upon coming to government, one of the first things the Andrews Labor government did was refer the matter of medicinal cannabis to the Victorian Law Reform Commission. The Victorian Law Reform Commission is an independent entity which tackles quite significant and complex social and legal issues. Ian Freckleton QC, who is an expert in medico-legal issues, was appointed as Special Commissioner to oversee this review. The Commission was asked to report on options to legalise and regulate the use of medicinal cannabis for patients in exceptional circumstances. Importantly, the Commission was not asked whether to change the law, but how to change it. The Victorian Law Reform Commission reviewed and made recommendations on who should be eligible to use medicinal cannabis, on what the prescribing practices should be, as well as the regulation of the manufacturing and distribution of medicinal cannabis products. I would like to acknowledge the extraordinary work of Ian Freckleton and his team at the Victorian Law Reform Commission in developing a comprehensive report within an extremely tight timeframe. The VLRC was extremely thorough in its investigation, completing extensive public consultation which included public forums, written submissions and private consultations. It also drew upon expertise of two separate panels, one of which was a clinical panel and one was a panel expert in regulation. It also consulted widely within the community. It travelled around the state and had, I think, 9 town hall meetings in regional and rural Victoria. And of course they heard many compelling stories from patients and families about why medicinal cannabis should be legal.
So the VLRC's medicinal cannabis report was tabled in Parliament on the 6th of October last year, and the government accepted all 42 recommendations with 2 in principle. The 2 accepted in principle relate to the recommended medical conditions and symptoms for patient eligibility. The VLRC considered the best option was to establish a fully operational scheme that would regulate local cultivation and production in Victoria, as well as specify the types of medical practitioners to authorise eligible patients under Victorian law, but importantly, the VLRC's report was based on compassion.
So, the next step was for us in the task force. Like we mentioned, the report was tabled in October, and we had but 6 weeks to take from that report and draft all of the recommendations into a piece of legislation. Now that sounds a little bit boring, I'm sure, but it was a pretty intensive piece of work to be done in the time frame that it was needed to be done. And as promised by the government, it was introduced into the Parliament before the end of the year, on the 8th of December last year. It passed our lower house of Parliament with unanimous support from both opposition and crossbenchers. But days later, on the 24th of February, the Commonwealth Parliament, the Australian Parliament, passed extensive amendments to its own Narcotic Drugs Act to exclusively regulate cultivation and production of cannabis for medicinal and scientific purposes in Australia. That meant that we had to regroup because our bill, as it was first introduced into the Victorian Parliament, had extensive provisions around cultivation. So we had to go and make significant amendments to the legislation that we had introduced, and we were happy to do so because it was a positive step with the Commonwealth legislation. So the House amendments were introduced into the Upper House in April, and indeed the Access to Medicinal Cannabis Act passed the Victorian Parliament at around 6:21 p.m, I think it was, on the 12th of April. Important to note that while this was an achievement, it wasn't one that exists in isolation. We would like to take the opportunity to acknowledge the cooperation and the collegiate work that the Commonwealth has done with us to progress this issue. We have worked closely with both the Office of Drug Control and the Therapeutic Goods Administration through the development of our legislation, and we continue to work closely throughout the implementation to ensure that patients can access medicinal cannabis products in Victoria from early 2017.
The Victorian scheme strikes a balance between compassion and the best available clinical evidence. We are continuing to learn more about the therapeutic effects and safety of medicinal cannabis, and there are several clinical trials underway in Australia and overseas. While the Victorian scheme will not wait for the conclusion of these trials before enabling broader access, the soon-to-be-established Office of Medicinal Cannabis will monitor and respond to the ever-growing evidence base. While gold standard clinical trials are the usual process for drug development, it is necessary to balance quality, safety, and efficacy with the pressing public health need. The Victorian scheme will provide legal access to quality-controlled whole plant, or, rightly put by Justin Sinclair in the previous presentation, full spectrum medicinal cannabis products. And we are working as quickly as possible to enable that to happen.
So, as to the aspects of the scheme, importantly, the legislation establishes an independent medical advisory committee, which will also include consumer patient advocate representation, and its role is to provide ongoing advice about access to medicinal cannabis regarding patient eligibility, the type of products that should be made available through our scheme, and endorsing clinical guidance. Ongoing input from the medical profession will be sought to make sure that access is as safe as possible and that the medical profession is well equipped to participate in the scheme. The Victorian scheme is a learning model. Specialists will initiate access to medicinal cannabis, and GPs will have responsibility for ongoing monitoring, which will continue to build the evidence base on safety and efficacy. The Office of Medicinal Cannabis is being established to administer our scheme. The office will work with clinicians, specialists and general practitioners to help them understand their role in prescribing medicinal cannabis. It will also work with patients and families to educate them about medicinal cannabis and eligibility for the scheme. For the scheme to be successful, and this was a very important aspect of the VLRC's considerations, you can build the most perfect framework in the world, but if the product that comes out the other end is unaffordable, well, there's not much impetus for people to stop using black market product of unknown quality and go to a more regulated, defined product. So to that end, the Victorian Government announced in its budget a hardship fund to assist families facing financial difficulties to be able to access and afford medicinal cannabis.
While the VLRC delivered a comprehensive roadmap to change the law, it did not turn its mind to how it would be implemented. The Victorian Government intends to implement the scheme through a phased approach where patient eligibility and commercial production of approved medicinal cannabis products will expand over time. This recognises that this is major social and health reform that legalises a long-standing prohibited substance. This implementation will see government take the reins in the first instance and allow government to learn while a regulated market is established. As a first step, a horticultural trial is being undertaken at a secure research facility overseen by a Victorian Government department. An important feature of this trial is the DNA fingerprinting that will distinguish bona fide medicinal cannabis from black market product. And the results of this trial will inform future development of medicinal cannabis products in Victoria.
Just before we swap that slide, that's not a stock photo, that is actually plant from our horticultural trial in Victoria. Just wanted to point that out. So, to the phased approach of implementing our framework. The government has made an absolutely rock-solid commitment that from 2017, medicinal cannabis products will be made available to children with intractable epilepsy. While all patients in exceptional circumstances deserve access to medicinal cannabis, the government has, in the first instance, limited patient eligibility to children with intractable epilepsy, as they are a small, discrete group with good clinical evidence that medicinal cannabis can assist with seizures. Plus, there is no question that kids with intractable epilepsy are what started the conversation in Victoria in the first place. In the future, medicinal cannabis will be made available to other patient groups following the advice of the Independent Medical Advisory Committee. I must stress that the government is absolutely committed to enabling access to all patients in exceptional circumstances, but taking a careful, incremental approach to implementation. Or, as our Minister for Agriculture said in the Parliament when our bill was being debated in committee, we must learn to walk before we can run.
As we have said, the scheme will transition to a regulated market for supply to a larger group of patients, and we are working as quickly as possible to facilitate this expansion. This represents an opportunity for innovation, new business, and job creation in cultivation, manufacturing, and supporting technologies. The government is very keen to establish Victoria as a hub for the new medicinal cannabis industry. We are interested in hearing from reputable companies interested in medicinal cannabis, noting that the Commonwealth will be responsible for regulating cultivation and production of cannabis.
So, just to finish, we've put up some quotes that were received from our Victorian Law Reform Commission during its consultation process, and these quite succinctly highlight the impact of medicinal cannabis on the lives of Victorians. As our Premier has stated on numerous occasions, no parent should ever have to choose between saving their child's life and breaking the law. I would like to thank Lucy and Lou Haslam and Troy Langman for hosting this event and for bringing the issue to the forefront of politics on behalf of the many people who might benefit from medicinal cannabis. Thank you.
Just before you guys go, we do have a very brief presentation for you as well. Thank you so much for coming.